Shamir, it's me.
Bethany.
It's me.
Okay.
Okay.
All right, Tanya, I'm ready.
All right. Okay. All right.
Tanya, can you bring that closer?
Sure can. Okay. Can you see that right there?
Mm-hmm.
All right. So we've
I
got a
can.
PowerPoint brought up here just so everybody can see it. I'm going to scroll down to where I had the SNAPPS model with the patient. Okay. All right. And I think we're ready. All right.
Okay.
Good evening, Miss Carter. My name is Tanya, and this is Bethany, and we are student nurses at Winston-Salem State University, and this is our instructor, Dr. Ennis. Can you tell me your name and date of birth?
My birthday is February 28th.
Shamira,
I'm
were you able to
38
get
years
in?
old.
Yes, I'm in.
Okay. All right. Can you tell me what brings you in today?
The pain is the worst in my back.
Okay. When did your pain begin? Three days ago. Okay. Have you taken anything for your pain?
Ibuprofen has helped. I took it at 1:30 today.
At 1:30 today. Okay. Are you allergic to any medicine?
I don't have any allergies.
Okay. All right. What's your past medical history?
I was diagnosed with anxiety 2 years ago. I
Okay.
have asthma. I have
Okay.
polycystic ovary syndrome.
Okay.
Okay.
Okay. All right. Dr. Ennis, is there anything else that we should?
Do you want to ask her if she's been having, since she's having pain in her lower back, you want to ask her about her urine, if she's been having trouble urinating, Tanya?
Okay. Yeah. So, do you have any problems going to the bathroom and urinating? It
It
burns when
burns
you
in my
pee. Okay. Okay. All right. Well, we are going to do a quick head-to-toe assessment on you, if that's okay. Bethany and I are, and
Okay.
we're going to go ahead and get started. All right. Okay. I'm just going to feel some pulses here. Hey, Dr.
Nothing
Ennis,
this finger.
pulses
Yes.
are equal bilaterally.
Okay. Do you need
And
me to take your blood pressure while you're on this side of the bed?
yes, ma'am. Thank you.
All right. And
Pedal
so while
pulses
you're
are
taking your
equal.
blood, while you're doing that, let's summarize some of the history that she gave you. Can you give me a brief summary?
Yeah, so she comes in with the following complaints: generalized malaise, right flank pain that she's rating a 5 out of a 10, new onset dysuria with worsening urinary frequency. She states that it began 3 to 4 days ago. When I was looking through her chart, I noticed that she was saw in an urgent care facility 3 days ago, and they diagnosed her with a UTI. She took Bactrim daily for 3 days, and she completed the course. She's took Motrin for back pain. Her last dose was today at 13:30. She complains of nausea and anorexia but denies vomiting. Past medical history of generalized anxiety disorder times 2 years. Asthma, polycystic ovarian syndrome, history of panic attacks. She takes Lexapro 10 milligrams QAM, albuterol meter dose inhaler PRN for her asthma. She takes a birth control pill daily, and she takes ibuprofen 600 milligrams PRN. She's currently not allergic to any medicine. Her social history is no children. She lives with her fiance. She's a secretary at a veterinary hospital, and her sister's with her today at the bedside. Her vital signs are 108 over 70. Pulse is 92. Respiratory are 16. Her temp was 100.1. Her O2 sat's 97% on room air. She currently has an IV going in her right AC, D5 normal saline going at 125. The doctor has ordered penicillin to be sent from pharmacy. However, it has not arrived yet.
Okay. So let's narrow down some things. You and Bethany. Let's think about her symptoms, her, and let's see what we can come up with. What do you think? Let's narrow down the diagnosis.
So she had
UTI.
a UTI, yeah, and maybe it's just not been fully treated.
Mm-hmm.
Okay, so we have
Okay.
UTI. What else can be
Thought,
causing these symptoms?
thought about pyelonephritis.
Okay.
Yep.
Bethany, do you have
Nope.
anything?
I have nothing further to add at this time.
Possibly a kidney stone.
Kidney stone. Yeah, I guess maybe a kidney stone.
Yeah.
Okay.
PID?
And
Somebody said I heard them. They said
Yep.
PID?
Yep.
PID.
Anybody else?
Okay. Anybody else?
Okay. All right.
All right.
Bladder.
Let me
I'm
get back over
Nadia's
here with
sister.
you.
Hey, how are you?
All right. How are you?
hello.
Okay.
Okay, Dr. Ennis. So, should
So
I?
we've narrowed down the differentials, and that we
Yeah.
just need to analyze our information that we have here so that we can come up with a concrete diagnosis. You see her
Yeah.
vital signs. Do we have
Mhm.
any urine samples or anything that we need to send down, or do we know of anything of that?
We have not collected one yet.
Okay, we can get one.
So, yeah. So as soon as
So we'll tell her if she needs urine so that we can send that to the lab and have that
so,
analyzed.
Miss Carter, if you need to go to the bathroom and pee, just let us know. And I've got this cup here for you.
Oh, okay.
And if you would, this is for you, Mom. Y'all, that's all we got. Sorry.
No, I think I went there and
Oh.
sent it to the lab.
Oh Lord, she
That
spit.
Oh.
Look, she
urine
spit.
cup.
We're gonna
Oh,
act
let
like
me
this
grab
is
this
urine
trash
though.
can.
You can put it in the
Yeah,
chute.
this is her
Oh
trash
my
can.
god.
You want to put here? I'm gonna give it to you to
Let's
put
put
it in the
this.
chute.
Put it in the chute, and there it goes. Okay. All right. Okay. So it could possibly be a UTI based on her dysuria, her frequency, and her recurrent, possible recurrent UTI. Thought about pyelo because of dysuria, flank pain, and frequency, fever, and the recent UTI, and then thought about a kidney stone. And
All
her
right.
medicine is up from pharmacy. Okay.
Okay.
So we are supposed to get Bethany. What are we getting? Piperacillin. Here we go. Okay, here it
Yep,
is.
some Zosyn. Okay. Let's
All
get
right.
it. There it is.
All right. Will it let you grab
Oh.
it? Here we go. Okay.
All right, can you tell me your name and date of birth? Take all your
And just
time you
confirm
need.
you're not allergic to any
Okay.
medicine.
You know,
Okay.
And what is piperacillin? What is that for?
My
it's an
birthday is
antibiotic.
February
Oh.
28th. I'm 38 years old.
Okay.
Alrighty. This is for uh, this is for an infection. This is an antibiotic to treat something.
Okay.
Until we know what we
And
have, we're going to start you on
Bethany,
this.
I have cleaned her IV
Oh.
site with
Okay.
alcohol.
Right.
And
Just
here
going to
we go.
detach it here.
All right, Miss Carter, we are starting your antibiotic
What is this medication that you are giving me?
to knock out any infection that's possibly lingering from your UTI or possible pyelonephritis. It's an antibiotic, piperacillin.
Okay.
Okay.
Does she
Have
need to
anything
get any
else?
more
you.
medications?
Piperacillin. She's got her
Dextrose.
dextrose. Actually, it's hanging, so we can.
Are you having
hold
any
that.
more pain?
Are you okay, Miss Carter?
Oh god.
No.
We're having
Are
a
you okay?
reaction. Let's
Oh,
stop
okay.
this. Let's undo
Okay.
this.
Let's undo this. Okay, Miss Carter, can you tell me what's going on?
Let me see.
Vitals. Take vitals.
Yeah,
I can't reach it.
I got it. She said she can't
I can't breathe.
breathe, so
Oh.
let's analyze some things. What do you think is
Okay.
happening here?
I'm calling the doctor.
So, well,
Oh,
we
you are
have
the
an
doctor.
antibiotic. Bethany cut it off. But we also
Hello,
have,
this is Dr. Hill.
Hey, this is Sonia. I'm a student Nurse
Patient.
University. I just
Bethany.
have a different feeling on Miss
Continuous
Carter,
monitors.
and now she can't breathe, and we have to stop the antibiotic.
What is your assessment of the patient?
Her blood pressure is 109/74. She's complaining of difficulty breathing. Her O2 sat right now is at 96%.
All right, let's put some oxygen on her then. She said she can't breathe. Do we have the oxygen? We have. She's
Contact the
96%.
respiratory therapist about that.
Thank you.
Oh, we don't need
All
them
of the
right now.
necessary
Oh, really?
orders have been placed. I will be up within the hour to see the patient.
All right, let's put this non. You want to put that non-rebreather on her? I put the non-rebreather
Where's
on
it
her. We
at?
can turn this
there we
up.
go.
Yep, and turn
Oh,
that
um,
up back there. Okay, Miss Carter, tell me how you're doing now.
Do we have it up to 15 liters?
Oh,
Can I put her in high powers?
Yes.
Somebody said put it in high Fowler.
Oh, well, I can't reach her
I got her.
Okay.
Okay.
What else can we do? What else can we do? Do we have new orders?
Yeah.
Respiratory treatment.
Let's see here.
Benadryl.
How about albuterol, guys?
That
Okay.
sounds good.
Yep.
Yeah.
Oh.
Perfect.
Injection.
She said no. Wait, what?
Where's it
Oh,
at?
she can't breathe. Give her some.
Oh, she can't
Check
breathe.
your
Check
orders.
your orders.
Yeah.
Okay.
Hold on.
Albuterol. Oh,
Mm,
wait a minute. Solumedrol.
that's what you need.
All
That's
right,
a
so
good
let's
one.
analyze. If she started getting the Zosyn and she had an allergic reaction, what is some medication we may need to give her?
Okay, so we don't need the albuterol because of its reaction, so we probably need some solumedrol. Possibly some
Do we have
Benadryl.
Histamine.
Do we have any kind of epinephrine or Benadryl over
We
there?
do. We got
do?
some epi right here.
And there's a little syringe. I'm gonna grab an alcohol pad. Okay.
So what are we administering?
Epi.
This is epi.
We do not have solumedrol.
Is that supposed to be IV? Is that IV?
It does not say
What the orders
on the
say.
thing. It says 1 to 1,000, 0.5 mLs, 0.5
Yeah.
milligrams of 1 ml.
It says
Read the
Read the-
order.
Order.
Oh. It's not in there.
we are students.
The doctor will be here in an hour. Don't
All of
worry.
the necessary orders have been placed. I will be
here we
up
go, here we
within
go.
the hour to see the
Urines.
patient.
Oxygen. Medications. Here we go. Oh, solumedrol. There it is. Let's give some.
Epinephrine. It don't still say what route. We're gonna say IV, but don't give it IV.
What's going on?
Oh, Mr.
Daphne.
President. There we go. What? What?
There it is.
Sorry.
What are we doing?
Okay, right here it is.
I am. Read the order. I am. I don't see I am. Hold on.
Right here. Can you
That's your
get that up?
solumedrol. Yep.
Yeah, let's give that. Okay.
Is this to be given IV? I mean IM? What is this?
So,
It does not say.
IV push.
If,
IV push.
IV push.
Here we
Okay.
go. I've cleaned you.
Clean.
Okay. How you doing, Miss Carter? Giving you a little medicine to help you breathe better.
She
Yeah,
did.
no, she's dead. She's dead.
coughing.
Her O2. Oh.
She's blue. Oh my god.
Mhm.
I think she looked like that.
Where
Where's
is
the doctor?
I need respiratory therapy.
Let's scissor back up.
She blue first.
Let's do albuterol.
Hello, this is Adam with respiratory.
Hey,
Need you to
Adam,
come
I need
on,
you to
Adam.
come to Miss Carter's room. She's had an allergic reaction to antibiotic and
Code
she
blue.
can't breathe. We've gave solumedrol
She breathing?
and I need you.
She got a pulse. She got a
Is-
pulse. She got a pulse.
Can you come?
PEA.
What
She's
are
shaking.
the
Dang, PEA. She's shaking. Okay.
Did you give the IM epi,
Yes. Yes.
Yeah.
We gave epi.
or did it drop on the? It gave the epi.
Albuterol can be
Uh-huh.
given to alleviate wheezing.
All right,
No,
let's
you
give some
have to come.
albuterol.
Adam, she can't breathe.
She breathing.
Albuterol. Here you go. Like, y'all making me be a
Here
we
shit
go.
nurse and a peds nurse.
Well, I'll make
It's
sure.
albuterol.
She's about
I'm
to
gonna sit down.
DC to JC.
All right, the albuterol's going. We did that.
And we gave the epi,
done
right?
Uh huh.
Okay.
This is albuterol. Put that. Get on there.
Alright,
What does it say?
assess
It
patient
says
lungs.
lung.
Okay,
Where'd my stethoscope go?
right there.
It's right there.
Bethany, you look a little lost.
Like, where's the
Alright,
at? I
take a
just
deep
had
breath.
it. Why ain't your mask on? Okay.
She sounds clear.
So what could we think that's possibly happened here? She has no
She's had an
allergies in her
allergic
chart, but do we think that
reaction.
she's had an allergic reaction to the Zosyn?
Yes.
Mm-hmm.
And so while
Okay.
we're waiting on
Anybody else
respiratory,
think of anything?
we've analyzed the data so that we now can go to the which is our first P, which is probing, right? So
Hello,
what
this is
questions do
Dr.
you
Hill.
have?
It's about
Um,
time.
So,
Was the IV
The hell you
steroid
could come
given?
on.
Yes.
okay, so, probing,
Girl,
so why was the patient only given 3-day supply of antibiotics?
Say that one more time, Tanya?
So when I'm probing,
Oh.
in our scenario, so I'm just wondering why when she went to the urgent care, she only got 3-day supply of antibiotic. Because we're down to like a minute, so I'm going to go ahead and finish this up. She's supposed to be breathing better by now.
Let me hold your hand.
She's not gonna
Ooh, she's
be
shaking.
breathing at all. Yeah. You got beat her all, make sure. Jittery. Is it good? The cough. She's out of here.
Patient is not improving.
So next step, we've done epi, we've assessed her lungs, we've done solumedrol,
Pray.
Benadryl.
Benadryl,
We
Rapid
Anything else
response.
in your orders?
rapid response.
I don't know why I'm up here
I
now.
see you.
Hold on.
You're floating.
Yeah, I see you,
She died. You're the angel.
Oh, Jesus.
I
She
know.
needs a
I'm
higher
like way
level
up
of
here
care.
now.
A higher
Yeah.
level
Check
of
the
epi.
orders. Check the epi orders.
Okay.
R.I.P.
You don't read for orders right there. Orders.
Okay.
Oh shoot.
It was on there. Oh.
What does it say? Respiratory call. Wait.
RRT.
Pal.
RT
Every
call.
15 minutes.
Every
Give her
15 minutes,
500.
again.
Okay. Happy.
I should stop coughing.
Can you reach it?
Yeah.
There?
I think that.
Okay.
I think,
I'm gonna grab your alcohol swab.
What time?
Am I
is it
giving us
getting?
IM again? Are we giving us IM or IV? Because it don't say. But it says injection.
Her IV's like
IV?
so.
Okay. Alright.
What does it
Said
say?
yes.
Yes.
IV. Yes, IV.
I
Yes,
don't know why my
IV.
thing is.
Oh,
Okay.
it. Wait, what does that say? I am?
Yeah, it says I am.
Is it going in there? There you go.
Recheck her blood pressure.
Okay.
Is it floating around or is it going in?
$97.68.
Ooh.
Oh, shucks.
Oh, she
Uh,
is
All
bold.
right. So, but we don't have to do a bolus right now because she's not less than 90.
B90 or what?
What's her map?
And to answer,
Yeah.
Her map
Map's
is
83.
83.
okay.
This is patient's cardiovascular and respiratory.
It's enough.
Okay.
So, what's that heart rate? 109? Or
109.
Why did that happen?
Which is the epi.
Okay, so
Oh,
she's talking now. She asked, why did that happen? So we can tell her that you can explain to her what made her have the allergic reaction. And to answer your question about why she received a 3-day dose, the recommended dose of Bactrim DS for treatment of UTI is 1 to 2 tablets every 12 hours for 10 to 14 days. So I'm not sure why she only had a 3-day supply of Bactrim.
Because she probably has a recurrent UTI. Alright, Ms. Carter, you had a reaction to an antibiotic called piperacillin, so we need to make sure that we add that to your allergy list, okay? We gave you a couple doses of epinephrine, and you've also got that albuterol, so you may feel a little jittery, a little shaky here for the next little bit.
Okay.
Okay.
What other questions?
So, should we have sent a urine for culture?
We should have
That's
sent the
good.
urinalysis for culture, but according to the patient, they did take a specimen. She is unclear if they sent it for culture, and labs are still pending for the results.
Okay. Is there any reason to order additional imaging such as CT or KUV X-ray?
A CT scan would be appropriate based on the patient's symptoms and her history of UTI and her complaints of pain. So I do agree that another CT scan or KUV is would be beneficial.
Okay.
Oh, that's so sweet.
And so let's discuss the patient's the final P, which is discussing the plan of care for this patient at this point.
Okay, so I was going to say let's give her antibiotics, but obviously she's allergic to this antibiotic. We are still going to have to give her an antibiotic. We're just going to have to find one that she's not allergic to, but we're going to have to get her stable first before we try another one. If she's still in pain, we can give her some more Motrin or Tylenol if she does spike up, which she does have a little bit of a fever, so we could probably give her some Tylenol. Or if she needs something stronger, we could call a provider and give her something like Percocet, which has acetaminophen in it, which will cover pain and her fever. And then we just need to keep monitoring not only her symptoms, but now what's happened here right now.
Okay.
All right. Time's up soon. Okay. Hey, she's going to be okay. She had allergic reaction, and we're going to take good care of her. I think we have it under control. She's just going to have her breathing's calming down, and we're going to get her taken care of. Okay. Did I show you in?
Yeah, we can exit out.